Greetings to everyone. Welcome to our YouTube channel. I am Dr. Rana Basil Mehmood and today we will discuss our new lecture. Let's start our video. First of all, we will talk about viral hepatitis. चलिए वीडियो को अंत तक देखते रहिए. Now I will give you introduction about viral hepatitis. Hepatitis means inflammation of the liver. Different hepatotropic viruses are hepatitis such as A, B, C, D, E, F and G. Hepatitis A and E are waterborne, community-acquired hepatitis. Hepatitis B, C, D are mostly by parentally route. Then we will talk about hepatitis A. HAV is non-enveloped RNA virus. Only one serotype, man is the only reservoir. Infection induces lifelong immunity. Extremely resistant to degradation, so spreads rapidly by fecal-oral route by contaminated food and water, but cannot survive boiling more than 5 minutes, autoclaving and chlorination. After that, we will talk about clinical features. First one, average incubation period is 30, that is 10 to 50 days. During this period, virus replicates. Period of infectivity is 2 weeks before and 1 week after appearance of jaundice. Infection may be inapparent, subclinical, anicteric and lacteric. अब हम बात करते हैं इनअपेरेंट में क्या चीज़ें हैं. इनअपेरेंट इंक्लूड्स एसिम्प्टोमेटिक नॉर्मल लिवर इंजाइम एंड सबक्लिनिकल में इंक्लूड है एसिम्प्टोमेटिक एलिवेटेड लिवर इंजाइम. थर्ड एनेक्टेरिक में इंक्लूड है सिम्प्टोमेटिक विदाउट जॉन्डिस एंड लास्ट वन में इंक्लूड है जो कि लैक्टेरिक सिम्प्टोमेटिक विद जॉन्डिस. देन वी विल टॉक अबाउट 3 phases. फर्स्ट वन है प्रोड्रोमल फेज, सेकंड वन है लैक्टेरिक फेज एंड थर्ड वन है रिकवरी फेज. प्रोड्रोमल फेज में इंक्लूड है लास्ट फॉर अ वीक, कैरेक्टराइज्ड बाय फीवर, लॉस ऑफ एपिटाइट, फैटीग, एब्डोमिनल पेन, नोजिया, वॉमिटिंग, डार्क कलर यूरिन. और लैक्टेरिक फेज में इंक्लूड है clinical jaundice develops, last for 1 to 4 weeks, liver is enlarged and tender. लास्ट जो कि थर्ड वन वो है रिकवरी फेज, इसमें इंक्लूड है पेशेंट स्टार्ट्स इम्प्रूविंग 1 to 2 week after the onset of jaundice. Fever improves after 5 to 7 days of jaundice. Then around 0.1 to 1% of patients develop severe hepatic necrosis. Development of hepatic encephalopathy characterized by lethargies, seizures, abnormal movements, coma and death. And last point है mortality is high, that is 60 to 70%. Then we will talk about diagnosis. First one है diagnosis of acute hepatitis A is made by detection of anti-HAV IgM in serum, appears around 3 weeks after the exposure. Titer increases over 4 to 6 weeks, then decline and completely disappear after 4 to 6 months. Anti-HAV IgG appears late but persists for lifelong and provides protection. Then we will talk about management. First one, supportive non-specific treatment. No role of antiviral. Maintain nutrition, euvolemia, hygiene, adequate rest, antipyretics. Avoid hepatotoxic drug. Prognosis is excellent in fulminant hepatitis, that is liver transplantation. Then we will talk about prevention. First one, improvement in sanitation, hygiene, water supply, immunization, that is inactivated HAV vaccine, 2 doses at 6 months apart, recommended after 1 year, protective efficacy, that is 95 to 100%. Then we will talk about hepatitis C. First one, first described in 1978 after an epidemic affecting 52,000 persons in Kashmir. HEV is a single-stranded RNA virus transmitted by fecal route by contaminated water and food. It causes sporadic and epidemic viral hepatitis. Common age group affected are 15 to 40 years and uncommon in children. Then we will talk about its clinical features. First one, incubation period 6 to 8 weeks, average 40 days. Clinical presentation is similar to hepatitis A. Severity is more in HIV hepatitis, particularly in pregnant women. The disease is very severe with mortality around 20% third trimester. Leads to premature delivery with high neonatal mortality. No evidence of chronic infection, carrier state, or recurrence of hepatitis C. Then we will talk about its diagnosis. Reduction of anti-IgM HIV antibodies in serum. Anti-IgM is followed by anti-IgG antibodies. Anti-IgG antibodies provide long-term protection against subsequent infections. After that, we will talk about our last slide, जो कि है treatment. First one है supportive non-specific treatment. Prevention is the most effective measure. High quality water supply. Improve in sanitation. No vaccine available now. I hope कि ये all information आपके लिए helpful होगी. Don't forget to subscribe our channel. Thanks for watching this video.